do have some great experts today, Dr. Michelle Wang and Dr. Sarkar. As you can see, we were a part of the 2024 Tournament of Roses Parade, and we're starting to plan 2025, so stay tuned for that. Please contact us. Here's our contact information. It's also in the chat if you'd like to copy and paste that. We have our website that's filled with lots of information, and we're actually revamping now, revamping our website now. So please take a look at it. There's a lot of great information. This is what it's looking like now. We also have, so you can follow us. Here's our Instagram and Facebook page as well. So please follow us. Lots of great updates, information there too. This event is for informational purposes only and is not a substitute for medical advice or treatment. Please consult your physician or qualified healthcare professional before making any changes. And UCLA Core Kidney Health Program doesn't guarantee, sorry, the accuracy of information regarding your individual diagnosis. So please contact your healthcare provider before making any changes. So this is very important. We are actually #1 in California and Los Angeles by US News and World Report. This is usually in our emails, so you can take a look at that there. Support our fight against kidney disease. We have a link, giving.ucla.edu /kidney. That's going to be in our chat too, so you can take a look at that. Our Circle of Core, very important. They are our kidney patient support and advocacy organization. They're an extension of the UCLA Core Kidney Program. So you'll see our Circle of Core. I think if everybody was keeping track of our Facebook posts and Instagram, we had a lot of green ribbon spotlights. We had all of our Circle of Core were actually presented there. So it was really fun to see our bios for all of our Circle of Core that we have currently. And here they are. CORE, of course, stands for Clinical Excellence, Outreach, Research, and Education. And then our Bruin Beans. We can't forget about our Bruin Beans. They're always behind the scenes. They are part of our chat. They control, or they lead this chat. So we have to give them all credit. And then our Green Ribbon campaign. I think our Green Ribbon spotlights spotlighted a lot of or most of our Circle of Core members. This was launched in 2017, and it is for kidney health awareness. So Green Ribbon, just like the pink ribbon for breast awareness, breast cancer awareness, we have our kidney health awareness with the Green Ribbon, and we wear it very proudly. So I'm going to go ahead and introduce Dr. Sarkar. She can start the program. We also have Dr. Wang. And they're going to be giving a few basics on kidney disease. Hopefully you all learned something today. And please ask questions.
Thank you, Christina. Hi, everybody. I hope everybody can hear me and see my screen. Again, I'm going to go through some very basic information about the kidneys. The intention is to stimulate you to ask as many questions as possible. Remember, no question is a dumb question. No question is out of context. We are here to help, and hopefully we can get you some answers today. So some simple facts. We all kind of have heard of kidney disease, but it is more prevalent than we know of. It impacts approximately 37 million people in the United States, quite a number. What this mean is like 1 in 7 people you will meet will have some form of kidney disease. Again, I think my computer in this. Okay, so what are the signs of kidney problems? So some of the common ones patients do come to our clinics with include they have this swelling which is otherwise unexplained. It's happening because of fluid retention, most commonly in their legs. Some people do it in the belly. Some people notice it more so on the face and limbs, upper limbs, I meant. A few people can get chest and back pain, although it's not a very common presenting symptom, but yes, it's prevalent. Shortness of breath. If you're holding back fluids and are not able to eliminate it out, it will soon catch up with you and you'll start noticing changes to your breathing. Some people experience decreased urine output, more so towards the spectrum of advanced kidney disease. Some people will notice frothy urine. Mostly froth represents the protein that you start leaking. So, more importantly, is that kidney disease is commonly asymptomatic, meaning that for most part of your journey, you will not feel any symptoms or sometimes not be aware of it until you hit the late stages of kidney disease. They are located right in the middle of your belly, more towards the back. They're retroperitoneal organs. So if you put two hands on the back of your spine, one on each side, you will notice that's where the kidneys are. They're a little bit lower down when we usually bump into people who think. They are connected to the bladder through these two narrow tubes called ureters. And if you cut open, that's how an average kidney kind of looks like. So the normal kidney is on the left side when it's having a healthy function, its proper size, it will have low urine protein. So the size of the kidney kind of is dependent on how tall you are. A lot of the people comment on when you were born premature or not because it impacts the size of the kidney. The average kidney in an American human who's approximately kind of like 5 feet tall would be anywhere between 10 to 11 centimeters. It has a certain size kind of sponginess to it. And most importantly, a healthy kidney should not leak any protein. It's compare that to a kidney which has some kind of kidney disease. What would you notice is like it has a granularity to its surface. So it has gone through injury. So the smoothness and the curviness of it is maybe eliminating. You will have decreased function on labs. Many a times, if there's chronic kidney disease, they start to shrink in size because remember, any kind of injury brings in fibrosis, which means a lot of permanent changes in there. So the size starts to drop. That's what your doctor is trying to get when they order an ultrasound in the setting of kidney disease. And many a times, diseased kidney will start spilling protein. So you will notice higher protein than normal. What do your kidneys do? Important to know. One of the most complex organs in your body, one of the organs which get the maximum blood supply of the body too after the heart. So heart pumps and the kidneys filter. So remember, like you have as much as 6 liters of blood in your body. On an average, all of that blood flows through these two kidneys many times during the day. And they kind of purify and get rid of the waste products. So whatever you're eating, whatever you're drinking, whatever kind of exposures your body is going through, the toxins that are developed will go towards the kidney and kind of filter it. So they purify your blood, getting rid of waste products in the process of forming urine. So urine is the end product of the filtration process, essentially. So cleaning up process, excess water, excess toxins, and that's what your urine is. They are involved in fluid, electrolyte, and acid-base maintenance. So two of the things, fluid, as I said, water balance, electrolytes, as I said, what you eat, what you drink, what you go through in a day. If you ate something with high potassium, a normal kidney would eliminate that high potassium. So you'll notice your urine can have that high potassium. If you eat red meat, which builds up a lot of acid load on your body, the kidney will excrete out more acid. So it kind of maintains and looks after your body. Again, if you're on medications, some, if not all, medications are eliminated by the kidney. Many of them are also eliminated by the liver. But a lot of common antibiotics, a lot of common painkillers, a lot of the contrast that you get during radiological studies is eliminated by the kidney. And hence the doctors, if you were visiting them in a kidney clinic, will ask you that. They have a number of hormonal functions. So in order to generate blood, you need a support of a hormone called estrogen. And to maintain the vitamin D balance, you need kidneys to kind of help you out. So lo and behold, people with kidney disease tend to have problems both with anemia and many a times with bone mineral problems. So that's a very complex subject of itself. However, if you notice, and if you are somebody who's dealing with kidney disease, you will notice the doctors focusing on these two aspects quite a lot during your time in their clinics. blood pressure maintenance. So if your organ, as you think of it, if it's doing the job of maintaining the water balance, if it's doing the job of maintaining the salt balance of your body, it's in essentiality doing a maintenance of blood pressure in your body. So it's a very important organ for managing the blood pressure. So it works hand in hand with the heart to kind of balance out the electrolytes, balance out the blood flows, balance out the blood pressures. And then this is the inside of a kidney. So your kidney is essentially formed by millions of these. So this is like a single functioning unit of the kidney. It's called a nephron, and hence a kidney doctor is called a nephrologist. So kidney kind of regulates your water balance, your acid-base balance, your electrolytes, nitrogenous waste. Now remember, a lot of kidney patients know and heard the word nitrogenous waste as BUN or BUN or blood urea nitrogen. That's essentially one way of us to measure how much toxin you're generating. So if you're eating a lot of protein, you will notice it's kind of higher. If you're eating and working out and have a lot of muscle mass in your body, your BUN tends to rise higher. And then it excretes all of these things to kind of balance it out. Then, okay, so how do you know when you get a kidney problem? Essentially, one of these functions that we talked about will have a problem. So you can get swelling. So if you're holding too much water because the kidneys are kind of struggling in terms of removing the excess water you generate, your body will swell up. So a lot of the times kidney patients come to the doctor's office and they are swollen. They could have back pain. So remember where the kidneys were located, they were located in the back next to the spine. So if they are swollen because they are not able to completely empty, or if they are feeling the pressure build up from down there, then you can feel back pain. Blood in the urine. So there are diseases that can cause inflammation in the kidney, or problems like kidney stones, or problems like infections, which can cause leakage of blood in the urine. And the blood can be both like something that you can see or something that you cannot see. That's for your doctor to look into your urine analysis. In advanced kidney disease, you can notice a decline in your kidney's urine output. So you will stop making urine, or you will make less urine than you were before. A lot of the times this is happening when patients are headed towards dialysis. And most of the symptoms that you get are a result of the body not able to excrete out the toxins or manage the water. Frothiness of urine, a question very commonly asked, is basically the froth comes from the protein that leaks in the urine. So if you're noticing your froth coming out in the urine, it's time to kind of get a check with your primary of your urine. And most importantly, the most common symptom of kidney disease is asymptomatic. So most of the times you will have no symptoms at all. So how do you assess your kidney function? So how would you know if you have kidney problems or not? So essentially, we are going to do a blood test. We're going to do a urine test. We can do some imaging studies. We can do a kidney biopsy if we need to. So you can have your simple, like basic metabolic panels, or your kidney function testing, which looks at your electrolytes. You have your urine test, which looks at if you're spilling blood, if you're spilling protein, if you're noticing any kind of bacteria in your blood, or if what we call sometimes as CAS. And then the imaging studies, as I said, you can get an ultrasound or a CT-KUB to look at the size of the kidneys. The ultrasound is also good at looking at if you have cysts in your kidney, if you have kidney stones. And the biopsy is sometimes necessary in situations where, your doctor's trying to figure out what's wrong. Some of these tests have not given us the answer. We kind of need more information. So you go through a kidney biopsy, which is a little bit of an invasive procedure. They take a piece of your tissue, the pathologist looks at it and kind of tries and understand if you have problems happening in your kidney. So blood tests. So most commonly you've heard kind of patients and your doctors mention the word creatinine. So creatinine is a way of kind of assessing kidney function. Now remember, nothing is absolute. In the same way, creatinine is not absolute. And sometimes it's not enough to answer the question if I have kidney problems or my kidney function is getting worse. So the next step is really to know about GFR, which is the glomerular filtration rate. So remember, each of that nephron that we showed you, the small part of the kidney, it kind of filters, and that filtration helps us understand the percentage of your kidney that is functioning versus not functioning. And again, we do the urine tests. We look for protein, more specifically albumin we are looking for, although we look for other proteins too in certain situations like patients with cancer, multiple myeloma, we are trying to look if they are spilling other proteins. And then imaging studies and biopsies. Okay, so what tests do you do and how well your kidneys are functioning? Again, blood test for creatinine, for GFR, for electrolytes. Timed urine collection is not very common in your first visit, but sometimes your doctor may want to get more information. Nuclear medicine tests like LASIK scans and nuclear medicine scans, which are good for prognosis. So basically, prognostic tests, meaning they're good to look at how much of your kidney function is present. Sometimes we don't want to go for a biopsy. We just want to see, is it worth doing a biopsy if the imaging are not showing. So we can send you for what's called like a LASIK or a nuclear medicine scan test. I think this wants to kind of move. Okay, so types of kidney injury, they can be acute, they can be chronic. So acute meaning something that's happening within most commonly a 3-month time frame. High chances because it's happening acute. We can get some reversal. We start to use the word chronic if that kidney injury is kind of floating around for more than 90 days or 3 months time frame. Again, these definitions are not absolute. So remember, you could meet a doctor the first time, they look at your numbers, they look at the trend that you've been having, they understand the kidney through different kind of imaging that you may have had, through the history you give, through exposures, and they can still call you chronic kidney disease. So again, acute and chronic, yes, it's a time frame based things, but again, acute is more so something that happened very fast for you and it's expected to return, come down. Chronic is sometimes it's been there. This is the first time you're encountering it, but your body has been dealing with for a long time. And we are now kind of on this path of irreversibility. Okay. All right. I don't know if Dr. Huang wants to go over this slide.
Sure. Hi, I'm Michelle Huang. I'm a nephrologist at UCLA. I'll be going over the rest of the slides. Again, this is just the information only. And then if you have any questions, we're here to answer your questions. So for chronic kidney disease, there are 5 stages when we're looking at the eGFR, about the percentage. Stage 1 is when your GFR is equal or greater than 90%. And stage 2 is anywhere between 60 to 89. And stage 3 is 30 to 59. And there is also stage 3A and B in that stage 3. And stage 4 is 15 to 29. And stage 5 is basically your kidneys, not really working as well. It's less than 15%. Or if you're on dialysis, we also call it as a stage 5 or dialysis as well. Next slide. Okay, so what are some common causes of kidney disease? Okay, so number 1 cause of chronic kidney disease in the United States population is diabetes. And the second one is high blood pressure. Third one is ADPKD. ADPKD is genetic disease. And then glomerulonephritis, like Dr. Sarkar mentioned, that if there is inflammation or infection in the kidneys, that could cause your kidney disease. And there's many other reasons. Sometimes people who have heart disease, who have liver disease, because we have kidneys it doesn't work independently. It's really affected by if you have infection, like during COVID pandemic time, a lot of people who never had a kidney disease had also developed kidney disease because your other organ is not working. So this list is not comprehensive. There is many other reasons um, that we can do, like drugs, like herbal medication. There's a lot of medication that could, like Dr. Sarkar mentioned before, when you take any medications or any herbal supplements or anything, a lot of them actually get rid of by either your liver or your kidneys. So it's include both prescribed and also over the counter. The common over the counter medication that people take without knowing that might cause kidney disease, or those are ibuprofens, Advils, naproxens, or any like like NSAIDs, non-steroidal anti-inflammatory like medications, and herbal medication. Certain medication could cause kidney disease as well. And then I often sometimes see patient excessive protein supplementation, like, all your proteins that you ingest is filtered by your kidneys. So if you have ingested a lot of it, what your kidneys could handle, that can also cause your kidney disease as well. And also certain infections, HIV, hepatitis C, or any immune disease, like lupus nephritis or like rheumatoid or any Sjogren's or any other autoimmune disease could damage your kidneys. Next one. You can just advance the whole page. Okay. So this is basically what, sorry, I think the previous one. Go ahead. Yes. So those are the drugs that I kind of mentioned, the NSAIDs, ibuprofen, Motrin, Aleve. Like some people, when I say that, like they get very, very nervous taking those medication. I'm just saying it's not for everyone. So it's like this. Not everyone who smokes will end up in a lung cancer, but a lot of people who have lung cancers end up, has smoking history. So a lot of people taking those NSAIDs are okay without developing kidney disease, but for certain patients, we don't know who, it's probably genetic related, could not really tolerate the anti-inflammatory drugs like ibuprofens and Motrins. And also, there's a lot of studies about proton pump inhibitor like Nexium's, Prilosec, a lot of medication that you might not think about anything else. You just pick it up because it's over the counter. We're trying to like emphasize that not all over the counter medications are safe. So always ask your doctors, make sure that it's safe for you to take. This is not absolute. Sometimes you may need to take those proton pump inhibitors for your any gastritis or inflammation in your stomach. Sometimes we have to take it, but we just have to make sure that there is a possibility for kidney injuries. And renal dosing is something that we use in the medical field that based on your clearance, like based on how well your kidneys can clear the kidneys, certain antibiotics, certain antivirals, certain medications had to be adjusted based on your clearance. And in contrast with the imaging studies, certain CT contrast could damage your kidneys. Angiograms is also like the contrast, the CT contrast. People do get angiograms when you have any, you want to looking at the vessels in any particular body. It could be brain, it could be heart, it could be anywhere. Next one. So those are like traditional risk factors and non-traditional risk factors. It's just for their reference, what kind of people will get, kidney disease more easily. Anyone who, older age. There is a study that male sex is a higher risk for kidney disease than females. Any who has any history of high blood pressure, any high cholesterol, and if you have any history of diabetes or smoking history, or after menopause, any family history of cardiovascular disease, or have a history of enlarged heart. Non-traditional ones are non-traditional ones is usually genetic. So if you have any autoimmune like inflammatory disease, or if you have any overload for it, like if your heart cannot really pump so well and you end up having more fluid in your body, you have a higher chance to get a kidney disease. And then if you have any autoimmune disease, any increased inflammatory markers to get higher, put you a little bit higher risk for the kidney disease. Those are the there's as a common most risk factors, but it's not a exclusive list. So if you have any if you're worried that your kidneys might be in the risk, just ask your doctors to check your kidney function, which can be done in a basic metabolic or a complete metabolic. So what are the complications associated with the chronic kidney disease? So, like Dr. Sarkar mentioned before, a lot of kidney disease symptoms are asymptomatic. So, but kidneys do a lot of different functions that most people are not aware of. You might develop anemia. You might develop iron deficiency anemia, or your vitamin D or your calcium level can be altered, or your protein level in the body is getting low because you're leaking protein for any other like kidney disease, or sometimes acid base level could happen because kidneys are mainly responsible to get rid of extra protein. And then when your kidney is not really working, your body is retaining more of acid. So our body is very tightly controlled pH level. So if your acid cannot be get rid of, your blood can become more acidic. And cardiovascular disease. Number one mortality for dialysis or any chronic kidney disease patients is cardiovascular. So you can't really clean all the toxins. You cannot get rid of all the extra fluid the kidney usually responsible for. Your heart might get in stress. And high blood pressure, because you cannot really get rid of the salt or extra water, you end up gaining more of those extra fluid in your body, and that might increase your blood pressure. And fluid management kind of get along, same with the hypertension. Next one. Okay, so high blood pressure. I do get this question quite a lot from a patient, or what is, normal blood pressure? The short answer is depends. Depends on your situation, depends on your age, depends on your benefit and risk of what we try to target. So for instance, if someone who just had a stroke, your targeted blood pressure might be different for someone who is completely healthy but does have some genetic disease that they might develop any kidney disease in the future. So the goal might be different. So some people's blood pressure goal, it might be 140 over 980, but if you have diabetes, it could be 135 over 80. However, if you're someone who's frail and have higher risk of fall, then we may increase your blood pressure level as goal as well. So it really depends on your situation. However, the normal blood pressure should be around 120 over 80. Again, some people's baseline blood pressure could be 100 over 60. That could be normal for them. But it just everyone is depends. But technically, the normal blood pressure is 120 over 80, and we try to keep it lower than 130 over 80. Home readings are very important when you go to a doctor's office. We call it white coat, symptoms, even though a lot of doctors after COVID do not really wear white coat. When you're in the office, when you're seeing a doctor checking, those blood pressure, clinic blood pressure might not really good representative of what your true blood pressure is. So home readings, what you do at home correctly, is also very important data to discuss with your primary care doctors or nephrologists to discuss if your blood pressure is at goal or not. ACE inhibitors, ARBs, it's one of the mostly common use blood pressure medication that we use. Lisinopril, losartan, I think a lot of people are on it. And then if you have any heart disease, Entresto is part of it as well. So this is just one of many blood pressure medications that we use to treat blood pressure. Salt intake is also very important. Number one, when you treat a blood pressure, we go over lifestyle modification. High salt intake, which is a lot of time is hidden in, but whenever I tell my patients, gotta watch your salt, and the first response they say is, I do not add salt. However, unfortunately, a lot of food that you buy or you purchase, in the supermarket or even sandwich store or a restaurant, they already add a lot of salt in the food. So there's not really, your fault or anything. It's just important for you to know what type of food that you can add. Maybe ask them to put in the seasoning on the side. Maybe get it more grilled vegetables. If you it's very important to kind of know to find out what are the hidden salt is. Next slide. Anemia and iron, also a very important thing to kind of watch for when you have a chronic kidney disease. Nephrologist might check your hemoglobin, iron level to make sure that your hemoglobin level is within the range. Bone disease, since the kidneys are very important organ to produce and then make a balance the hormones between your bone, calcium and phosphate and vitamin D level. Your doctors might check the phosphorus level, calcium level, and vitamin D25 level to make sure that all the vitamins are stored, so your body will not, you do not develop any premature osteoporosis or osteopenia. Acid load. Okay. So like I kind of briefly touched about this topic earlier. Acid load could happen. It's becoming a little more technical when we go here. It's more for a nephrologist and a primary care doctor. So kidneys are very important organ to get rid of those acid. Acid are not like, vinegar or anything like salad dressing or lemon that you take. It's mainly coming from your protein. So anything when the protein kind of, metabolize it becoming acid, and those acid usually get rid of by kidneys. However, when your kidneys are not working, those acids stay in your body. And like I discussed before, our body is maintained a very tightly regulated pH level. And if that pH level is altered, all those cells, including the brain, heart, lung, you name it, all the organs might not work optimally when your acid is too much in your body. Electrolytes. So kidneys are also responsible to regulate a lot of electrolytes, including sodiums, potassiums, calciums, and phosphorus. Potassiums are. It's also, I wanted to make a point that, sometimes patients come into my office and asking, "Oh, I look it online, and this is a kidney diet." And I wanted to emphasize that you also always should talk to your doctors first to see what kind of diet that your doctor might recommend, because I may recommend different diet or different restrictions, different lifestyle, depends on your stage. If someone who's reaching to dialysis, the restriction, the dietary restriction or anything I might recommend to them might be different someone who's in stage 1. So sometimes I see it quite often that people already kind of restricting themselves, although you don't really have to restrict all those. Because the reason I say it is a lot of people restrict potassiums, and potassium is coming from a lot of good vegetables. And a lot of people don't really have to restrict potassium unless you're in a kind of later stage. So always have to check your potassiums, always have to check what your electrolyte balance is to see what your dietary restrictions should be. Next slide. So we do in the core kidney, we do a lot of clinical research. I think Dr. Rastogi has been doing like research past 20 years. I think he did like more than 150 clinical research. So UCLA is cutting edge and we're doing a lot of research, including genetic disease, APOL1, and there are also a lot of like ADPKDs, Fabry's, and Dr. Sarkar can comment on that. We do a lot of dialysis. We do a lot of like newer medications or any previous medication that possibly benefit from anything else. So we do a lot of clinical research to make sure that we develop any better medication to treat the kidneys and to delay the kidney progression.
Well, thanks, Dr. Huang.
I mean, on the dialysis.
Yeah, no, fantastic. Thank you, Dr. Huang, for emphasizing those points, because we're lucky to actually have Shima on the line, who is a specialist dietitian. So those points on salt, those points on what kind of diet, what kind of protein, all those things, I would love to hear her out, because I think nobody makes those points better than her. I always learn from her.
Thank you so much, Dr. Sarkar. Thank you, Dr. Wong. It's a pleasure. Thanks for having me right now on too. Yes, I absolutely agree with Dr. Wong. The problem with this whole online information about potassium, phosphorus, sodium, those are all the problems we usually go through. And what I would say is the easiest way would be just like read the labels carefully, and plus exactly what Dr. Wong said. If you're on stage 1 versus stage 2 versus stage 3 or 4, everything is going to be different. We also have patients with stage 4 kidney disease, and their potassium levels are still on even like sometimes lower side, or they can have like a little bit like normal side, and we don't need to really limit potassium from the diet. And unfortunately, online information is so black and white, to the point is not only individualized for one person, and it can be only for everyone. It's like I've looked at it before. I Googled it before myself too, seeing like it says renal diet or kidney friendly diet, and it gives you all the limitation from potassium, sodium, phosphorus, everything together. Plus, sometimes we don't have like people with only kidney disease. There's always like something underneath going on. Like, for example, somebody has some sort of diabetes issue going on, and then you also compare diabetes with kidney disease. And I do have people that I see them sometimes very overwhelmed with, well, I used to have this diet high protein, but now my doctor is telling me that I need to limit my protein. What should I do? Because my blood sugar is also like running really high. So these are the different things that you're just like looking at. What I would say is you definitely need to speak to your doctor. You definitely need to see a dietitian who really specializes in kidney disease, diabetes, heart disease, because it's not only one, it's like so many different things we have to take a look. It's also like cultural, right? It might be something that you like it, and there's always a way that we can substitute one for another. One of the biggest thing that I always hear, and then sometimes we get into trouble, is a protein intake. I really want to touch base on that, because sometimes people end up with limiting too much protein, and they get into trouble with malnutrition. So we don't need malnutrition for you. You're going to end up losing your muscle mass. And sometimes these people are just waiting for transplant, and then they go to transplant centers, and then sometimes people say, you know what, the transplant center says your BMI is lower than what it is right now, and we have to hold off on your transplant. So we need to definitely go into more in depth and see what your needs are for protein. And then usually if we calculate that based on your body weight, your whole situation, are you stage 1? Are you stage 2? Is it end stage renal disease? Are you on dialysis? Are you already got transplant? So the protein needs for every person is going to be different. One of the best protein options, of course, we always promote is mostly plant-based. And when we talk about plant-based diet, of course, there's so much information, advertisement on those new products that are just advertised as healthy, and then they advertise as plant-based. But sometimes when you look at the ingredients and you look at the nutrition facts, they are full of additives, they are full of sodium, and of course potassium, or even sometimes phosphorus, that can cause a problem for patients. So what I always like recommend is mostly just go as much as natural you can. It is complicated the very first time when you started, but know that we are always here to help you, to support you, to figure out what is going to be the best for you, because you cannot just go all by yourself and Google, get some information, and then start from there, because then you're going to end up with other problems. A lot of people ask about so many different diets. Of course, like there's intermittent fasting, there is so much different ones. There's ketogenic diet. Is it good? Is it bad? So those are so many different things that we have to look and see. And sometimes there's not really too much scientific based evidence out there that we can say, yeah, this is absolutely something that you want to do right now. But know that even with plant-based protein, you can still have your freedom from other animal proteins, but it's going to be like mostly on a leaner side. And it's going to be easier for you, instead of just like going online and search online for different kinds of different products. One thing about also salt, I wanted to just like touch base, because we've been seeing a lot of different salt substitutes at people going, and I'm hearing so many new ones. Like there's a green salt, there is a blue salt. I've heard from one of my patients. They are full of electrolytes. sometimes they use those salt additives or substitutes, and they make it full of potassium. So be very careful with those kind of different things, because they can be low in salt, but they can be high in potassium. So that's what I would really wanted to touch base and speak about.
Well, thank you, Shima. Thank you so much. And as you guys can see, like there's so much information out there. There's so much to learn. And all of us can feel overwhelmed. And I think mental health is one of the biggest aspects when you take care of yourself in any kind of sickness, more so in a sickness that is such, has a long kind of like can cover your entire lifespan many times. So I'm going to bring on Dr. James Cunningham to share some good pieces of advice with us. No better time to let Dr. JC jump in.
Hi, Dr. Sakar. Thank you for the introduction. We talk so much about nutrition, and we talk so much about pathology, and we talk so much about genetics. Well, when you're talking about the piece of psychology or mental health, I think as it pertains to kidney health, I think it's people learning how to take care and get their own needs met and become their own advocate with doctors. It's unfortunately, a lot of times there's a lot of different doctors giving them different opinions. And I think it's crucial for people to get to the point where they understand that they're just collateral references. You get a hold of a good nephrologist and they can pretty much guide you through, I think, what's necessary, or a good dietitian, or a good hematologist, or whatever kind of professional. But one of the things that I primarily do with kidney patients is treat anxiety and reactivity. And I think by treating those two diseases, I think once they get the original diagnosis, I think there's a lot of shock and awe, and people don't think they're going to live. But when they kind of deconstruct and understand that it's a process and that it is very survivable, and that they can maintain the kidney health that they currently have by taking care of themselves and losing weight or exercising or providing a certain kind of structure in their life that will help them be healthier. I think it imbues a certain amount of hope to them, and it's really kind of a miraculous kind of process. So I think people need to be consistent. I think they need to somehow, if they don't understand the process of psychology or exercise or eating well, I think they have to reformulate new habits, and they just learn to take care of their needs and get their needs met. It's like a child, and a lot of times people think certain things, but I think when they consult with professionals, they see there's a certain way that you can go about maintaining your current kidney function or improving it, or in the case of going to a transplant, you can kind of plan and regulate your emotions accordingly. It's a very there's so many facets and there's so many aspects of mental health that I think that need to be addressed with the original diagnosis. And a lot of times, some of these people are in therapy. But anyway, those are just a few thoughts. I think it's difficult to get really specific in terms of any modality of treatment. But I hope that's helpful.
No, it's really helpful.
Molly.
Thank you, Dr. Cunningham. Thank you so much. What I can tell you from experience is like the most important part of taking care of yourself is taking control of your own health, kind of accepting, and then choosing your own path. You will all walk this road at your own pace. You do need support, but you will always be different from somebody else. So you have to be your own advocate. You have to kind of look at yourself. And again, CORE is there to be by your side so you don't feel alone. I mean, that's our purpose. And on that note, I'm going to introduce a very strong advocate, Mr. Mark Cornell. He needs no introduction, so I'm going to hand it over to Mark. Go on, Mark. Tell us all
Oh,
about
thank you.
yourself and be yourself.
Hey, thank you, Dr. Sarkar. And listening to everyone today, thank you guys so much. It was very, very, very informative about the, sorry, I'm sorry, it just went out, but it's an amazing journey going through the journey of, us here as core members and having Dr. Huang, Dr. Sarkar, Jim Cunningham, Shima, and Dr. Rastogi really, really emphasizing the journey of what patients go through and getting on to these monthly webinars and us giving that information. It's very, very, I'm very thankful both for being a patient as well as the people who are just diagnosed, who are saying, where do I get information from? And this has been such a great source because this is what we need to raise awareness about. This is what core kidney is, the clinical excellence, the outreach, the research, and the education. Being first diagnosed, we don't really know what to ask, but coming onto these webinars are some things that really give us a foundation of the types of questions to ask when we go into physicians. And I've met with Dr. Huang and, talked to Dr. Sarkar and Dr. Jim Cunningham and Shima. And these are resources to make me better as a patient myself, right? I'd ask Dr. Sarkar, well, what if my kidney levels go down? Dr. Huang, what if they go up? Mr. Jim, look, I'm feeling this type of way. And these are very, very insightful notes for us to take because the journey of kidney transplant, being diagnosed and having being on dialysis, this is not a sprint. It's a long journey marathon. And I'm very, very thankful for the Core Kidney program to offer these educational components for us to stay ahead as patients because we're hearing it firsthand from doctors who are sharing this information. We have Shima sharing the dietary journey of what it's like to prolong kidney disease, and Jim Cunningham for giving us that mental stability of the times we do feel vulnerable, the times we do feel down, the times we do feel alone. So I want to thank you guys very, very much for the insightful information given today. As a patient and those patients who are listening today, because it is definitely a note worth taking. And thank you, Dr. Sarkar, for sharing that information today.
Well, thank you, Mark. Thank you, everybody. But we have some very good questions coming on. So let us take them. I think it's for everybody, but I will maybe start with Dr. Wong and ask, do both kidneys kind of decline at the same rate?
That's a very good question. Most of the time, yes. There are a few times that kidney functions only if you have trauma to one kidney, you might get, one kidney only working the other one. If you don't decide to donate one of your kidney to the other person, so you only have the other kidney. Most of the time, diabetes, high blood pressure, if you have any injury to the kidneys because of any other reasons, heart and lungs, both kidneys are affected at the same time. However, there are a few times when you have a kidney stones and only stuck in the one side, that only one unilateral one side could get affected more than the other. However, when we do blood tests, it is accumulation of added, addition of both kidneys are working. I sometimes I get a question from patients that, oh, I get a blood test and my EGFR, my percentage is 30%. Does it mean my both left and right? Yes, when we get a blood test, it shows your both kidneys.
Great, thank you. There's a question that asks about best alternative to ibuprofen Motrin. I think it's a very common question. We all get this. Actually, we will ask you about what you do if you get pain. So I think most common answer we will give you is Tylenol is perhaps the safest drug when it comes to that. If you have pain issues that are not possibly being controlled by Tylenol, we would recommend you stronger alternatives, not a jump to opioids, but for certain patients who may have had accidents, who may have had injuries, we do involve pain management doctors because, again, remember, NSAIDs are unsafe for your kidneys and they can cause a lot of other problems in again, Dr. Huang, I may pick up on your brain because you're so smart. So does genetics play a part in a person getting kidney disease?
Of course. I think Dr. Sarkar, you are in part of quite of clinical trials about the genetic kidney-related disease.
Yes. So, okay. I will. Well, that's why you're so smart. Okay. So yes, I think that's a very good question. So if you ask, does genetics play a part in a person getting kidney disease? Yes, it is. Are they the most common causes in terms of getting kidney disease? No. I mean, simple things being simple, I think the statistically speaking, most common problems are still diabetes. Most common problems are still hypertension. But there are diseases like ADPKD, so polycystic kidney disease that can run in the family. Fabry disease, which is another genetic disorder that can run in your kidneys, that can impact your heart. There are genes which specifically are part of certain populations, like the APOL one we hear a lot more about in the advertisements. Patients descending from Western Africa carry this gene, which puts them at risk for early kidney disease and more aggressive kidney disease. So a lot of genes, yes, they do play a very important factor. But again, just carrying a gene does not also mean you're going to get that disease. Most of the times, you need a second hit in most diseases for it to turn into actual kidney disease. And again, that in itself is not very benign because you can pass this on to your family members. And it's important to know if you can. So yes and no both. Dr. Huang, coming back to you now. How can patients extend their kidney life once they are on dialysis? Does that even matter?
Yes, it does matter. We call this as residual kidney function, which means, sometimes we do get 24-hour urine tests to see how much, your native kidneys are doing. Is very important because even with our current technology, with advanced science, we basically cannot do what the native kidneys can do, which clean the, produce all the hormones, clean the electrolytes and the waste product. And we can't even capture all the waste product that we even clearing. So it's very important to extend your kidney life. And no, I'm not going to get into very detail, but there are certain things that we can do during dialysis to kind of, extend your kidney life.
Perfect. Okay. Somebody brought up a very good question about blood tests. So what is urea nitrogen blood test? Just got results back and they're a tad high. Does that, so I think in essence, does that always mean you have kidney problems if your BUN is running high?
Are you asking me, Dr. Sharpa?
Yes, ma'am.
Not really. I think everyone's different. So I think the first thing I would do is to looking at your previous blood test to see what your previous urea nitrogen was, because you might be dehydrated at the time of the blood test. You might be fasting to get the cholesterol level. So there's many different reasons. And sometimes if you have a little bleeding, that might increase your urea nitrogen blood test. So just because you have an increased urea nitrogen, it does not mean that you have a bad kidneys. The first thing is to check your previous one and check back with your doctor. Most likely your doctor will ask you to hydrate more and then repeat it. If it's still high, then probably you have to get a little deeper dive.
Perfect. I don't know if Shima is still on. Shima, are you there? Because I think she had to leave for some telehealth appointments because there are certain questions about curcumin and lemon juice, which I think she would be very helpful about. What I can tell you is curcumin is more of an kind of anti-inflammatory. Again, the problem with us recommending such supplements is that we do not have good data to say if they really help or not. There've never been any kind of double-blinded trials or anything. So I cannot say with 100% confidence if it can hurt you or help you. And again, the second thing that's missing is the longitudinal study. So nobody's used these things for more than 10 years so far. They are all new and upcoming things in the market. only time will tell if they're safe or not. So personally, I do not recommend patients taking kind of herbal substitutes without discussing. And again, each case is different. So, you know, certain people ask us for magnesium for sleep or for like leg cramps. But again, remember, chronic kidney disease, you run a little bit higher on the magnesium. So every situation is different. And it's a personal take of every doctor based on their experience. There, again, no studies. So don't know if curcumin helps. Don't know if kind of psychedelics, what kind of impact they have in there for you. Now, I think there are this one. What are your comments about the 24-hour urine test to get the creatinine clearance stats? Dr. Huang, would you comment on that? I'll help you.
Sure. I mean, I think it really depends on your physician and at what, what they're looking for, because I often use 24-hour urine test. Number one, it's not an easy task to give it to your patient. And that basically means if I really have to do that to change their management, I tell them to stay at home all day, basically 24 hours. Most of the times I do for 24-hour urine test is when someone has kidney stone and I need to kind of look up how much protein, how much potassium, how much sodium, all the things that we need to kind of see what kind of lifestyle to see if to decrease the kidney stones. Other things, sometimes evaluating protein in the urine, we might do a 24-hour urine test to see how much exactly quantify the amount of protein that we do. And, I briefly mentioned earlier residual kidney function. When someone who's on dialysis, we do 24-hour urine test to see how much residual kidney function that they have, and then clearance-wise. And also sometimes we do use it for, estimating of the renal function. But since blood tests could give us the better answer and faster, we reserve those 24 hours only for certain medical conditions.
Fantastic. Thank you. 2 more questions. I think I can help out answering. Is omeprazole dangerous for kidneys? Any kind of drug can be harmful. Omeprazole has been known to cause kind of an allergic reaction. So yes, you are at risk of having that allergic reaction, or what's called allergic interstitial nephritis, so AIN. So yes, they can be potentially dangerous for the kidneys, especially if taken for a long time. And then how can someone, especially those over 60, avoid CKD? It seems impossible to avoid any kidney problems. Now, that's a very intelligent question, Michelle, because there is a lot of ongoing research about, do we want to call somebody who's having a decline with their age in their kidney function CKD? Because remember those little nephrons that we saw in the beginning of the slide set? They are gonna kind of decline in the number. In essence, if you're saying that your kidneys also age with time. So at the end of the day, you may not have CKD, but what's called a decline with age. We don't want to call people old, but I think your kidneys do get old. So you may not have CKD, just now expected decline. And yes, you know what, I know it seems frustrating, but it is impossible to, it is possible to avoid kidney problems. All right, any more questions? Well then, thank you so much, everybody, for joining so late in the evening. Thank you for being with us. And again, you have our contact. So if you feel you have more questions, if you feel there were questions that didn't get answered, feel free to write to us and we will try and include them or answer them, as much as possible. Please do also write to us about what topics do you want us to include in our future presentations. And with that note, thank you again. Thank you so much for listening to us.